in rural Asia with Leah Utyasheva. Leah is a human rights expert, legal researcher, and policy and law reform specialist. For the past 20 years, she has worked on human rights law and reforms in areas of gender equality, migration, health, and protection from discrimination of people with HIV, people who use drugs, and other vulnerable communities. She has participated in drafting legal aid, human rights, gender equality, and anti-discrimination legislation in various countries in Europe and Canada. She has extensive experience in working with decision makers, including the legal community, civil society, and parliamentarians. Please join me in welcoming to the stage Leah.
Thank you very much for having me, and thank you for the organizers to inviting me to speak about this very important problem of suicide by ingesting pesticides. So first, I want to get a quick show of hands. How many of you have heard about this problem before James's talk and before this conference? How many of you heard of it? Oh, wow. That's very amazing. This is much more than I usually get talking about this in North America or in Europe. It testifies to the fact that this room is exceptional. The conference attendees are exceptional. So I want to start with talking about this beautiful painting from Sri Lanka. It pictures a rural doctor who came to treat a sick child. And on the background, surprisingly for a painting which celebrates rural physicians, it shows a pesticide applicator. So it brings a parallel how similarly pesticide applicators and doctors' medicines were seen in the beginning of the Green Revolution when pesticides were introduced into the common use in agricultural communities. However, very soon, this view of pesticides were changed by something very much more sinister and more deadly. Out of 800,000 suicides that happen every year in the world, close to 150,000 deaths is due to pesticide self-poisoning. And this is probably a significant underestimation because suicides are, as you know, of course, are very stigmatized, and people do not want to publicize that someone in their families have died of pesticide suicide or any suicide. So this issue is fairly uncommon in Europe or North America. Maybe from 0 to 3% of people die of pesticide self-poisoning. But it is extremely prevalent in Southeast Asia, in Africa, in some countries in Africa, and in Western Pacific. So according to the WHO, it's the second most used global means of suicide. So who does it affect? It usually affects people in agricultural communities in poor countries where people have farming and smallholder farming as their main means of survival, as means of earning income. It affects mostly young people from 20 to 29 years old, and it usually affects more men than women. So obviously, people in different countries use different means for suicide. For example, in the United States, with wide availability of firearms, 56% of suicides are due to firearms. In Hong Kong, where lots of population live in high-rise buildings, a large percentage of suicides are due to jumping from heights. So here on this pie chart, you can see the difference in means that people use for suicide in England and Wales on the first chart, and in Australia. And in the red, you see that it's hanging, deaths due to hanging. On the lower level, you see Sri Lanka and China. And the dark blue indicates pesticide self-poisoning. So this is the difference. On this beautiful world map, you can see the distorted global burden of fatal self-poisoning in the world. And you see it's fairly uncommon in, so self-harm, not self-poisoning, self-harm in general. So it's fairly uncommon in North and South America, in Africa. It's pretty chunky in Europe, but it's extremely disproportionately overrepresented in China, India, and Japan and Korea. So why is this happening? It's very important to note here that it's not due to the fact that people harm themselves more in Southeast Asia. It's that the toxicity of the substances that people use are highly, much higher in low-income countries. So if someone in the West ingests overdose medication, the case fatality of this is less than 1%. So less than 1 person out of 100 will die of overdose of medication. But in Southeast Asia, when someone ingests pesticides, the case fatality of that is frequently between 60 and 70%. So 6 or 7 people out of 10 will die if they ingested even 1 mouthful of paraquat. It's a common usage insecticide. So those are the most dangerous poisons that are used currently for poisoning. And those are actually class 2 WHO classification pesticides. It's not even class 1. Class 1 has been banned in most countries already. This is class 2 that is still in use. Although even that has been banned mostly in the EU and North America. So as I said, incidents may be not that different from Europe, let's say. 350 incidences per 100,000 patients. However, if 1 in 200 patients die in the UK, let's say, 1 in 10 or 1 in 5 would die in India. The good news, however, is that those pesticide suicides have very low level of planning. They're impulsive acts. So usually people think of for less than 30 minutes before ingesting pesticides. Shocking, isn't it? People think for less than 30 minutes before doing this, engaging in this life-altering decision behavior. And this is also, this incident is also low repetition. Usually less than 10% of people will go try a suicide again if they attempted once. Less than 10% will go try it again. So pesticides became widely available in low-income countries as a result of Green Revolution. And together with the high-yield crops that were introduced into smallholder farms in low-income countries, tropical countries, pesticides and fertilizers that go together with the new plant strains were introduced as well. That made, of course, that increased food production manifold, which was great news for the entire world. Crops of wheat and rice were increased many-fold, maybe from 2 to 10-fold increase. However, smallholder farmers became dependent on those pesticides. Frequently, they apply them without much knowledge about how much needs to be applied, how to do it safely, how often to do it, and so on. So on this slide, we can see the consequence of introduction of aluminum phosphide, which is a common pesticide, into the agriculture in India. This slide is from one particular hospital in India, and it shows that, excuse me, so the suicide rate was fairly stable, around 20, maybe 25, from 72 to 82. And then with the introduction of aluminum phosphide, is increased dramatically to more than 200 incidences per 100,000 people. So what to do about it? A very common strategy that is suggested by the UN agencies, WHO, is means control. And it has proven to be very effective in many countries in the world. Barrier installation in Hong Kong reduced suicide rate significantly. Detoxification of gas in the UK reduced rates of suicide as well. And we're also, in our work, we're also advocating for harm minimization approach. That means that instead of telling people don't commit suicide or don't kill themselves, we accept that maybe this will happen. There are multiple reasons why people may want to do that. However, what we want to do is reduce harm from this. This idea was introduced by William Haddon, who was the head of the US National Highway Traffic Safety, and he, by introducing this method, he suggested that instead of telling people to be better drivers and avoid traffic accidents, he suggested that let's accept that traffic accidents will happen. However, let's reduce the risk that people face in those when accidents happen. So he redesigned the inside of the car. So instead of the death trap that it would become before, the car would be fairly safer. I'm not saying safe, but safer environment for the driver. So this harm minimization approach could be applied on different levels. On personal level, when you work with a patient minimizing harm from the poisoning, it could work on administrative level when you, let's say, control the sale or control the storage of pesticides. And it could work on regulatory level where you introduce intervention to change legislation. So now I want to talk about Sri Lanka, which is an incredible success story in this field. This is where my colleague, Professor Michael Edelston, worked for many years treating patients in hospital wards. So in the 60s, when highly hazardous pesticides were introduced into common use, the level of suicide in Sri Lanka was fairly stable at maybe 5 per 100,000 population. And it increased dramatically somewhere between, you can see between 60 and 80. It increased from 5 to maybe 24, and then it increased further on to 57 here per 100,000 population in 95. So this is a significant, incredible increased suicide rate, of course, which was noticed by the authorities. So those are the interventions on patient level that my colleague and the hospital teams all over the country tried, of course, but they quite soon realized that using this approach, you can only save a certain number of patients. Sometimes for many patients, it could be just too late. If they ingested this high lethality substance. So an intervention that was suggested at the administrative level is a safer storage of pesticides. So this was recommended by the WHO and by the International Association for Suicide Prevention, which meant that let's store the pesticides better. Let's remove them from the homes, let's say, and put them in the locked boxes. So the idea was that if people cannot immediately access pesticides, if they're stored in the locked box, removing them from immediate availability will help. However, it showed a large randomized control study that happened for many years in Sri Lanka and was just published in The Lancet this year, has shown that this is actually not the case. There are certain issues that exist with this intervention. The first one is that the locking of the boxes, the level of locking of the boxes has decreased significantly after the beginning of the trial. Second, boxes actually bring pesticides in the house instead of removing them away. And of course, this box could be easily opened in the moment of need. And then one more thing is that between 15 and 20% of all suicides, of all pesticides, were actually bought for the occasion of self-harming a person. So this intervention didn't really work. However, legislative intervention to better control pesticides and remove highly hazardous pesticides from the market did actually work. This person is Gamini Manuvera, who worked as a pesticide regulator in Sri Lanka during this incredible rise in suicide rate. So together with my co-founder, Professor Edelston, who collected the information on the pesticides that were actually used for suicide in Sri Lanka, they instituted intervention. So parathion and methylparathion were banned in 85, highly hazardous pesticides. However, very soon they became substituted by a different pesticide, equally hazardous as a means of suicide. That was banned in 98. All other class 1 pesticides were banned close to 2000, and then endosulfan and paraquat and fenthion were banned later on from 2001 to 2008. So you can see the incredible drop in the suicide rate in Sri Lanka. This is 70% drop from 57 per 100,000 to 17, which it currently is. 17 per 100,000. So 70% drop in suicide rate. So there are estimations how many lives and at what cost it saved. And it is very difficult to say because there are government interventions that needs to be factored into the cost analysis. So, but anyway, people estimate that it could be between $1.3 per dolly to maybe $5, $8 per dolly saved. And there are about 93,000 that was possibly saved by this intervention. what is interesting is that agricultural yields have not been affected by the ban of the pesticides, highly hazardous pesticides in Sri Lanka. So here on the slide, you can see Sri Lankan output in terms of crops, cereal crops, pulses, and roots and tubers. The Sri Lankan output is shown in pink. So it goes together with the global yields in that year. So what are the barriers to solution? Why not everyone would do this amazing intervention at low cost? The main barrier to this is that each country needs to determine for itself which pesticides are actually used as means of suicide. Different solutions may exist in different countries. Pesticide could be marketed under different brand names, under different generic names. They could be in different compounds and different mixtures. So the research, the study should be done in each country separately, which are the most commonly used and deadly pesticides, highly hazardous pesticides that are used. And as James mentioned before, those countries just don't have the capacity, the human capacity to do that. Amazing tools exist developed by WHO and FAO, how to determine which are the most hazardous pesticides and what are the substitutes to them. And I must say, we're not advocating for the removal of all pesticides from the market, because many of them are necessary. However, what we're saying is that those highly hazardous pesticides need to be removed and substituted by safer alternatives. So technical support for pesticide regulation could be a very cost-effective intervention to improve pesticide regulation and reduce suicides. So this is a map of where we work. We work in 2 countries currently, in India and Nepal, and we're working in 10 hospitals in Nepal and 20 hospitals in India, collecting information which pesticides are used for suicide. Our goals is hopefully to reduce suicide by 10–20% over 10 years. And we will do clinical trials to prove effectiveness and tractability of this problem. We will work with governments, WHO, and industry and civil society to provide this cost-effective intervention. And we will work differently in different countries. That's what we're planning to do. In Nepal, for example, we're already working with the pesticide regulator. So if this is the best and cost-effective way towards solving this problem, we will just work with the pesticide regulator without engaging the civil society. In countries where civil society is more engaged and already exists, engaged into this problem, we will work with civil society and other decision makers. And of course, I must say that to totally tackle this problem, one needs a comprehensive strategy that works on patient, community, and nation level. It's necessary to develop a comprehensive mental health strategy and comprehensive suicide strategy, and also improved health and mental health care, protection from discrimination, effective ethical reporting, and greater gender justice are all necessary to solve this problem. But what we're saying, and I hope what this talk was supposed to show, is that this one concrete intervention could be a long way into reducing numbers of suicide, pesticide suicide in low-income countries. And what I must add as well is that a lot of these people don't really want to die. As I said, the low planning, low impulsive events where people just react this way on life stressors. So this is the situation as it is, and I will show you a film right now. If we can show the film.
helmet එකක් ජරවලා ටී-ෂර්ට් එක ගලවලා එතන වහබීලා තියෙන්නේ. කොළ පෙරලි කොහමද උඩ හැට ඇවිල්ලා ටිකක්. අය කොහොම වහබි වමන් කිව්වා අයියේ කියලා. ඒක වැඩක් නැහැ නේ කිව්වා. ඒකොළ එම් අරන්ගින් මට වහ බෝතලේ හොයන්න නැහැ. ඒකත් ඔය අයිනේ බීලා තියෙන්නේ. කොළ මේ බෙහෙත් කඩෙන් ආපුවාරකෝ පැරකොට්ටයක් අරන් ගියේ කියලා.
This is the paraquat part, no? And we are at the moment giving John Fuller search. Starting on dexamethasone yesterday night. I hope he's receiving.
මේ බොරුවක්ද කියලා හිතුණා. මේක ගෙදරට ආවා ගෙදරට ආවිල්ලා බලුවා. පොළොන්නරුවෙන් ගියා කොහම මම රෙදි මාරු කරන මං ගියා පොළොන්නරු. ඒකනේ. එයා මේ බාදීපු මලකවල වලට වැඩියන්ට කැමති නැහැ මොකද අනේ තාත්තා බාබීලානේ මැරලා තියෙන්නේ කියලා කීප එක්කිනා නෙවෙයි.
කට ඔක්කොම පිච්චිලාද?
Nadika is only 23 years old. Just a year ago, he married his school sweetheart, who is just 17. He is the oldest in his family. Much like his father, farming is the family's main source of income.
අයියා දෙවැනි දවසේ ඉතින් මැරෙයි කියලා හිතන්නේ නැතුව එයා කිව්වා ජීවත් නම් වෙයි. ඒ වුණාට අවුරුද්දක් විතර එක තැන ඉඳ වෙයි කිව්වා.
2004 අවුරුද්දේ 6 වෙනි මාසේ ඉඳලා නොවැම්බර් මාසේ වෙනකම් මෙයාට අපල තියනවා කිව්වා. ඊට පස්සේ මෙයාට යන්ත්‍රයක් එහෙම දැම්මා. ඒක වුණාට මෙයා මල ගෙවල් තියෙනකොට යන්ත්‍රේ ගලවලා කොට්ටේ යටින් තියලා යනවා. ඉන්නේ නැහැ. ඊට පස්සේ ඉතින් බයන් නැතුව හිටියේ 2004 ගත වුණානේ. ඒක හින්දා 2004 ගත වුණාට පස්සේ තමයි මෙයා බැන්දේ. පුතාලා දැන් 3 දෙනාගෙන් එක පුතා ඉන්නේ තව. එක්කෙනෙක් අවුරුදු 7 ලෙයුකේමියා කියන ලෙඩේ හැදුනා.
Doctors tried all they could to save Nadika, but it was too late. The poison had burnt his mouth and travelled down his esophagus to his intestines. It had even worked its way into his lungs and his liver. He died slowly and painfully.
Nadika was admitted with the worst poisoning around Polonnaruwa, that is paraquat, because he died within 24 hours of admission. Usually this particular poison affects most of the organs, basically causing oxidative damage, and most of them die within 24 to 72 hours in the initial phase. And some of them, very few of them who have been discharged, who have been close to discharge, like about 7 to 14 days time, also have died.
Nadika, compared to his peers, had a more than comfortable life. His death leaves many questions unanswered as to why he poisoned himself.
මේ දැනටත් තියෙන වස අපි කුඹුරු ගොවිතැන් කරන අය අපේ ගෙදර රවුන්ඩ් අප් ගෙනල්ලා වල් බෙහෙත් දානවා. ඒවා දැන් තමයි අරන් තියලා තියෙන එතකම්ම මගේ කාමරේ මං ගිහින් තියා ගන්නවා මේ ළමයි. ඒ වුණාට ළමයි අල්ලන්නේ නැහැ. මේ ළමයි දෙන්න තමයි ගොවිතැන් කරන්නේ තෙල් ගහන්නේ අර මේ.
එහා ගමෙත් වහ බීලා දැන් 4 දිනක්ම මේ මල. ඉතින් මේක නිකන් දැන් නිකන් විහිළුවක් වගේ මේක අපිට වෙලා තියෙන්නේ. ඒ තරම් වහපානේ කරනවා මේ ගම්මානේ.
Tamanට කැමති දේ කිව්ව ගමන් දෙනවා. මේ ඕනම කෙනෙකුට දෙනවා. මේ ඔක්කොම ගොවිතැන් කරන ඉඳලා. අවුරුදුකින් 18ට පොඩ්ඩක් පොඩි කට්ටියට දෙන්නේ. අනිත් සාමාන්‍යයෙන් ඕන ගෑනු පිරිමි ඕන කෙනෙකුට කියොත් දෙනවා.
ප්‍රශ්න අහන්නේ?
නෑ.
Thank you. Yeah. Okay.
I think we have a couple minutes to do Q&A. Thanks again for this presentation. It's a really compelling cause, and I think one that's just not often on our radars.
Exactly. Yeah, it's very relatively unknown in the West.
Yeah, I found you said 30 minutes.
People usually think for 30 minutes before ingesting pesticides.
I found that particularly shocking. It's certainly not what I would have expected. You have quite a few questions from the audience. If you give me a second to bring those up, I'd be happy to ask things. 1 second. Yeah, all right. Well, I guess while it's taking a minute to load, I thought you might, if you feel like you're able to shed some light on this question, you seem to have found yourself in a particular niche, you know, an important problem that's also tractable and measurable in some ways. That I think it's easy to stumble across problems, but harder to find problems that have these good properties. Might you have general advice for people who are interested in trying to find a problem that has, you know, similar qualities to this one?
It's a very good question. Well, I think it's important that people do what they're passionate about. And I think if you follow your heart and see what bothers you most, you know, what are you passionate in the world, then it's easy to find a problem that needs solving. However, for this problem to be tractable and find a cost-effective solution, one may need to engage with academics, with PhD students. Maybe there's a need to do a wide literature review or something like this. This is all parts of the story. You know, our work has started this way, and it's not easy. Definitely, it's not easy. But there's so many problems worth solving, and scientific approach obviously helps.
All right, great. Now to a couple more specific questions. Someone asked, or they said, you've addressed intentional poisoning. How does this compare to unintentional poisoning? What fraction of pesticide poisoning deaths are intentional?
This is not our main problem that we're trying to solve. However, of course, unintentional poisoning is also a big problem in those countries. Occupational, so I would divide that into occupational poisoning when farmers expose themselves to those highly hazardous pesticides, and also unintentional poisoning when, for example, a child drinks a pesticide or something like this. And there was a horrific story only recently in 2013 when 23 children in India had died after eating lunch that was cooked with the oil stored in an empty pesticide container. 23 children died, or school-age children. So it just shows that those highly hazardous pesticides, of course, bring a lot of harm on many levels, not only on the level of suicide, but also on the levels of unintentional poisoning, on the level of storage, that people don't know how to store them, they don't know how to apply them very frequently. And also, those pesticides have been banned many of those highly hazardous pesticides have been banned in Europe and the United States and North America. However, they're still being used in Africa, illegally or legally, in many countries. It is a problem. And also, I must say, one interesting piece of information is that in Southeast Asia, pesticides are usually being over-applied by 50%. So people apply them more than necessary, they apply them more frequently than necessary, and they don't follow any precautions in terms of safety, wearing, personal protective equipment and such. So it's definitely a problem.
Yeah, and a member of the audience asked a question right along these lines. They said, why are these pesticides on the market at all? Is it possible to stop their manufacturing and then stop them in many countries?
Yeah, definitely. That's a very good question, why they're on the market. Safe alternatives exist. And this is what WHO actually is also working to do. So the United Nations agencies are fully behind this initiative. They have been working for many years also to reduce the highly hazardous pesticides. Why are they still on the market? And I must say, it's not only the big industry, big whatever, 3-6 European industries or North American industries that are behind this, because enormous amount of pesticides are produced in India, in China. I can't remember now the exact number, but maybe 50 to 60% of all pesticides are being produced in India and China. So it's a big problem to tackle. However, my opinion is that if industry is approached carefully, in a way, of course, one may just take them on, full force. On the other hand, if you just talk to them and say, listen, just remove those highly hazardous pesticides and develop safe alternatives, maybe this is a more cost-effective and easy solution to the problem.
Well, thank you again for sharing this with us. It's been a pleasure.
Thank you.